Prompted by citizens' petitions to FDA's 2009 final rule on dental amalgam, a panel of experts was convened. The following text offers background data of guidance for industry and FDA staff, with panel discussion following on the issue of bioaccumulation and clearance in addressing mercury exposure from dental amalgam.
How would the panel recommend the FDA incorporate the issues of bioaccumulation, which is where some people went in the last question, and clearance in assessing mercury exposure from dental amalgams? And I took risk out again because we took it out of the previous one. We don't have any?
You don't have the data, I would think. I mean, unless you've done studies where you've taken out all the amalgams and followed people for months as their urinary levels go down. I've not seen any of that. I mean, this is another, I think, limitation from not having any animal. This is where animal data could actually inform a lot of these parameters. And again, I don't know of any for mercury vapor. There's a lot for methyl mercury. Some for thimerosal too.
Yeah, but we're talking about,
Not
let's stay on the topic. I mean, just because, folks, you don't get to go home till we finish. Yes.
Would there be any data by organ site? And we're looking at certain organs, we're looking at where it's going. So does anybody own current data on organ site?
Well, what would we have that would look at kidney, for example?
Kidney's the main one I was thinking of. I don't know.
Creatinine levels, mercury in the urine. I'm just throwing out stuff that I know is there.
Exactly, I just don't know who would house it.
I'm not the expert in this field at all. You guys are. Dr. Ash.
Yeah, I'm not sure. What do you mean exactly by clearance? Because there is no cessation of exposure. So clearance and a biomarker of exposure in this case would seem to be the same thing. FDA?
It was as we defined it.
I think our main concern with this question, and you have a good point, Dr. Ashner, I think the main goal of this question was to address issues of bioaccumulation of mercury. It's known that mercury will slowly accumulate in several tissues, at least over time. And how do we factor that in when urinary mercuries, some people believe, may not reflect that continuing increase in concentration in tissues? Might go back to the urinary mercury as an appropriate biomarker or not. Does it actually reflect?
I mean, there might be some issues with susceptible populations where the clearance of mercury might be slower compared to the general population. But I think even for that type of subpopulation, we don't have the data, you know. So I'm not sure how you could look at bioaccumulation short of look at specific organs, which is obviously not amenable.
So you'd be talking about biopsies, for example.
Yeah, I mean,
I'm trying to
yeah.
capture your thought. Okay.
Yeah.
Yes, Mike Fleming. I wanted to address this to the FDA. This Part B was asked in the context of risk and not exposure necessarily.
Well, we took the word risk out.
Risk out.
Out because we took it out of A, and they were the same, part of the same thinking.
I'm just wondering that the patina on the question really has more to do with the issues of bioaccumulation and clearance and assessing risk, even though we took it out, which is why I think you asked it.
Yes.
So by taking it
want
out,
it in?
what are we offering you here?
I don't think we can answer.
Yeah,
I think
that's
risk,
correct.
I think risk belongs in this.
Risk
Yeah.
belongs in this.
I think it belongs in this question, not necessarily A, but I think it belongs, because the entire context changes.
Yeah.
Does that sound good?
Yes, that's correct.
So,
Okay.
so there are, if you just think about where the mercury ends up and what form it is, I think everybody agrees that once it gets to the brain, it's inorganic. And that doesn't matter whether it's methyl or thimerosal or mercury vapor, it seems. And we do have a little bit of data on inorganic mercury half-life, and it's like a year or two. But that data is fairly limited. It's from monkeys. There are some data, I think, from rodents as well. But it is a lot longer than the organic form. So it would be, the best estimates, which aren't based on that great of data, would be a year or two.
Okay. Yes.
Mike Dorsey here. So just a question to my FDA or panel colleagues. Yesterday, I seem to remember someone saying that there's a great excretion of mercury in feces. And I got the impression that it might even be more than a urine. Are there studies in humans on this? How did we come to that statement yesterday? I'm missing the recollection.
That was a study on 4 monkeys, according to my recollection.
Yes, that wasn't our statement. I believe that was a presentation by Dr. Ann Summers.
So then the question is, do we have those comparable data in humans? Is that where most of the excretion is?
Yes, there are comparable data. The Swedish group.
Are you asking?
Oh, I would love that.
Okay, that's fine. We just have to follow.
I understand.
And state your name,
Yes,
please.
right, Ann Summers, the University of Georgia.
Right.
We actually worked with 8 monkeys, and we did this in collaboration with Fritz Lorscheider and Marie Vinny in Canada, and all of those studies are published extensively, and I can provide you with references. And the fillings were placed and then removed in all but 2 of the monkeys, and the latter 2 monkeys, one of which I showed the other day, the fillings stayed in. So there's not huge population studies, but they were very thorough studies. And then with respect to people, there are Swedish studies and I think Finnish studies that actually followed on those studies for the purpose of evaluating that question explicitly in humans. And what they followed, I believe, in possibly blood mercury in more than 10 and less than 100, and I don't remember the exact number, of humans who were coming in to have their fillings removed. So they have good DMF data on them, and they have at least urine measure and blood measure but those are the only data that I know of on removal in humans. There may be other ones, but those are for a long time sort of standing ones from our animal studies.
Thank you.
Okay.